What is a fracture? A fracture is when a bone becomes cracked or broken under an external impact or stress. The femur's main job is to support the upper body and structure for the lower body. Not only is the femur used for support and structure, but it is also used to supply blood cells to the human body. The blood supply for the head of the femur passes through the neck. So if the neck is broken, then this can cause internal bleeding, which you can bleed out and die. There are two places where you can fracture your femur, in the neck and the shaft. The neck of the femur is the most likely place to be fractured in sport. The most common fracture of the femur are stress-related fractures. Because of its strength, it is very hard to create enough force to break the femur. This is because it is put under extreme pressure when an external force, directly or indirectly, is put on the body. In a report entitled Australian Sports Injuries Hospitalisation 2011 to 2012, 49% of sports injuries were fractures, with the knee and lower leg being the most common, with 4 out of 10 cases being fractures. In the hip and thigh region, there was 597 cases, but only 3% of the total injuries. The most common mechanism of injuries were fall, followed by transport accidents and contact with another person. 1 out of the 10 cases were considered life-threatening. 55% of all life-threatening injuries were fractures. Out of the life-threatening fractures, 22% were from the thigh and hip region. The top 3 sports where injuries occurred were AFL, soccer, and cycling. The 3 highest life-threatening sports were cycling, wheelchair sports, and equestrian. The most common sports where you would see a broken femur would be motorsport, because of its sudden impact and speeds of 250 km per hour. Another common sport that may cause a femoral fracture would be cycling, as they go at high speeds with little to no protection. Equestrian would be another common sport to get a femoral fracture, maybe not from a fall, but from the horse walking or even kicking the athlete. Water sports is another sport that has the potential to break your femur. With high speeds of boats, it is probably the obstacles around the lake and rivers that can cause serious harm. Another place for a femoral fracture would be running, because of its constant impact on the ground, creating stress fractures. There are 6 different types of classification of fractures. Transverse is a fracture usually from medial to lateral sides, or vice versa of the bone, usually from a side-on impact. Linear is a fracture usually from superior to inferior sides of the bone, usually from an impact running straight up or down the body. Oblique is usually a fracture from both medial and lateral sides of the bone and superior and inferior sides, creating a diagonal break, usually from a diagonal impact. Spiral is usually a fracture in both medial and lateral sides of the bone and superior and inferior sides of the bone, creating a spiral break in the bone, usually from a twisting motion creating the break. Green stick is a fracture usually from either medial or lateral sides of the bone and superior and inferior sides, creating an incomplete fracture, usually caused by stress fractures or low impact. Commutative is a fracture usually in either medial or lateral sides of the bone, or inferior and superior, creating bone fragments, not a clean break, usually from extreme pressure put on the bone. There are 2 types of fractures: simple fractures and compound fractures. Simple fractures are fractures that are closed and do not break the skin, whereas compound fractures break or cut the skin. There is another type of fracture: stress fractures. Unlike simple and compound, that are usually from an external impact, stress is the repetitive impact on bone. So runners are prone to stress fractures, not so much in their femurs, but other weaker bones in their lower body. Another way in which to break your femur, especially in elderly people, is disease. Diseases like osteoporosis can break the bone down, but the most common type of fracture would be a sudden impact to the bone with enough force to create a fracture. There are two different types of fractures, direct and indirect fractures. As their name suggests, direct fractures on the bone are a cause of direct impact, whereas indirect is an impact on another part of the body which the force is transferred to the fracture site. When a fracture is left untreated, the fracture can cause death. 6 to 8 hours after a fracture, blood begins to clot, causing a fracture hematoma. This in turn kills the bone cells around the fracture because of its inadequate blood supply. 48 hours after the fracture, an internal callus is formed by secreting fibrocartilage matrix at the ends of the two bones, while the chondrocytes and osteoblasts create an external callus. The external callus is made of hydrain cartilage and bone. These calluses are formed to stabilize the bone. Over the next couple of weeks, the osteocytes break down the dead bone around the fracture site. Slowly, the cartilage is replaced by bone through ossification. Eventually, the internal and external calluses meet. Spongy bone is replaced with on the outer margins of bone with compact bone. This conversion marks the end of the healing process. Swelling on the bone may still be around the fracture site, but most of the time the bone goes through remodeling to make the fracture site look as good as new. There are many ways to treat a broken femur, but the most common way is through surgery. This reduces hospitalization and recovery time. The surgery is straightforward. A metal rod is inserted into the two ends of the fracture site to stabilize the fracture. These metal rods help reinforce the bone, and the fracture can heal quicker than if it was put in a cast. The fracture usually takes about 2 or more months to heal completely. After surgery, you'll have to go through a physiotherapy plan to keep the strength in the leg and normal range of motion. A typical physiotherapy program is a 4-phase system. At the end of each phase, which lasts 3 weeks, the physiotherapist will conduct a test to determine if the patient is ready to move on to the next phase. In phase 1, walking with the help of crutches and no weight bearing on the fracture site. In the second phase, normal walking may be permitted and exercise on the non-affected area of the body. In phase 3, exercise on the both upper and lower bodies is performed with light weights as well as running in a straight line and on a stationary bike every second day. In the fourth phase, normal training is resumed. It takes about 12 to 18 weeks to get to phase 4,